Akathisia is very difficult for the patient to describe. Now, has anyone in this audience personally themselves had akathisia? Anyone experienced it? It's okay if you don't want to raise your hand, that's okay. Notice my hand is up. I have had it. So I've had 4 knee surgeries, and one of my knee surgeries, I got the patient-controlled anesthesia with, I don't know if it was Demerol or morphine, but it made me terribly nauseous, and so they gave me, of course, a D2 blocker, either Phenergan or one of those, Compazine, I don't know which, and I'm laying in the hospital bed, and I just wanted to peel my skin off. I started developing akathisia, and it gave me a whole new sensitivity to this. So it can be very difficult to describe, too. You almost feel like an elephant sitting on your chest, and you just, it's like ants in your pants. You can't get comfortable. So look for non-specific terms like anxiety or itching, restlessness. Since most of us have never experienced it, again, I have now, it's really hard to understand. Most of us have had other ailments and aches and pains and sedation and things from drugs, so we can kind of get it. Objective signs, disordered movement especially, lower extremities, you'll see a lot of movements, hips to ankles, shifting positions, moving the feet, crossing, uncrossing legs. As you get higher, for me, it was almost my whole body. You can feel it in the trunk. And that's because, I had IV, high concentration of a D2 blocker. You get writhing and rocking, jumping around, running, occasionally jumping, all kinds of movements. There are reports also in other body regions as well, so it's not only the lower extremities. And then strange or unusual distortions in other subjective or objective components, so consider other things as well, such as medical conditions that could also be causing some of this. The characteristic distribution, doesn't this look like at TSA, at the airport, that x-ray? Put you in here. It's anonymized. I don't know if it's a man or a woman. Okay, so this is the point. Have you ever wondered why the treatment we often use for akathisia is propranolol, is a beta blocker? That's norepinephrine. That's a norepinephrine receptor blocker. Have you ever wondered why? If akathisia is a dopamine problem, why am I using a norepinephrine drug to treat it? Only me, huh? No one else want to? Okay. Let's see if we can learn about why that is. Well, it turns out dopamine, of course, these are dopamine blockers, so we suspect that that's involved because you can see it with Parkinson's disease. You can see other disorders like restless leg was treated with dopamine agonists. Most antipsychotics are potent antagonists, but also let's remember it's more complicated. There's no direct link between Parkinson's and akathisia. Agents that cause the least EPS, so the newer atypicals cause less of the classic dystonia and Parkinsonism, but they still have significant rates of akathisia, so there's a disconnect there. And SSRIs, finally, it's been well reported, can cause akathisia. So perhaps indirect stimulation of 5-HT2A has something to do. Remember, you're stimulating here, you're inhibiting dopamine release. So it's like dopamine blocking indirectly.